Hi, everybody. Glad that you could join me today. I'm very excited to let you all know that this is a big giveaway alert. If you're somebody who is maybe in the Cape Charles viewing area, if you have some pesky spots, dots, whatnots, and you would like them to be looked at or treated, you're in the right place. We have things that, as we get older, just seem to creep up and rear their ugly heads, like skin tags, brown spots, broken capillaries, sebaceous hyperplasia, all of those things. Well, they can be easily treated in my office in Cape Charles. And today, one viewer will win a full treatment. Now, a full treatment can run anywhere from, say, $100 to $400, depending on the amount of irregularities, imperfections, whatever you would like to call them, you may have. So, I can see a lot of you have already maybe been in the office, but you may be married to a nice gentleman who also has some skin tags or any of these dots and spots that we have. So I want to let you all know how you can get in on the giveaway. And also, let me just get in here. Oh, hey, everybody. Wow, terrific. Hey, great. Glad to see everyone here. And if you want, you can just let me know where you're watching from. You might be watching from the Eastern Shore here, or you might be watching around the country. And even if you're around the country and you want a skin classic treatment because you've seen the great results here on my page, I'm going to tell you how you can also get a treatment. Let me just go in here, and I'm hoping everybody can hear me really, really well. And yes, the nurse is in. I am in the office during the week when I am not training others to do all of these terrific procedures. And okay, oh, great, great. Hello, hello. Let's see here. Okay, so let's get going with this so you can understand what we can do. Now, if you're hopping on for the first time, maybe you don't know who I am. I'm Stephanie Halvick. I'm a registered nurse, owner of RN Faces downtown here in Cape Charles, and I also have the Skin Classic for minor skin imperfections. So you may be watching from around the country or from around the corner. But if you go to my website, you will notice that I do go live generally every Monday. So I might be bringing you some helpful hints and tips on your skin, maybe the imperfections or the other procedures that I do in the office. And also, if you notice on my RN Faces Facebook page, you will see a little blurb there where I've been treating the blind for free since 1993. So if you have someone that you know is visually impaired and would like treatment in my office, please let them know that their treatments would be gratis. So I love to let you all know that. And with the Skin Classic, you can see right here that we have won the awards through Dermoscope magazine for many years and have an awesome community of providers that I've trained and my trainers have trained since 2007. So you're in good hands around the country. And if you are hopefully wondering maybe where you could get a treatment, let me show you this too. So we might be able to, let me get this up for you. Okay, great. So we have providers all over the world, actually, but I just popped in the United States here. So if you go to my website, RN Faces, then you can go to the Skin Classic page where you will see this awesome map. And this map has all of our providers. Now we update it weekly. My trusty assistant, Jackie and Bailey, really work hard at trying to keep everybody's listings up. And sometimes they move, so that can be a little challenging. But if you want treatment and you're in Oregon or you're in Washington, go right ahead and look in our map and you'll find a provider. Um, okay, let me just see here. I want to Oh, hey, Jen Marie and Brenda. Hey, everybody. Thank you for joining in. I really appreciate that. Okay, so you can get your treatment here on my map with any provider in the country. So that's an easy way to do that. Let me get started and show you everything that we can do. Now, if you are new and you haven't come into my office, I do send your um, paperwork electronically. It's super easy. You could just open your phone and start to fill them out. So one part of my form is actually letting me know what minor skin imperfections bother you and you might like to have them treated or looked at. And you can see by this list that there are quite a few things. So if you think you might have some of these imperfections, then you may as well try to go ahead and give me a call or stay with me. And if you want treatment and want the free treatment, just in the comments next to your name, put the word free. And then at the end of the broadcast, I'm going to spin and we're going to pick a winner who's going to get the free treatment. But also, it's important to, during a consultation, if there is anything that I feel like you really need to have looked at by a dermatologist, and, truly, we need to be at a dermatologist every year, which many of my clients do, but that can also rule out things that we can and cannot treat. And some things I may say to you, after looking with my derm light, if it's something that I don't see in my treatment area and I don't know what it is, and I might say to you, I would feel better if you made an appointment with your dermatologist to have that looked at. Maybe you haven't been to the dermatologist and you at least need a baseline. That's super important. We love to take care of skin, but we want to make sure that you're also doing a little bit on your end, like seeing a dermatologist as well. So we like that to happen, and you might get that encouragement from me. So how about if we go, let me just see here for a second. Okay. Okay. So, oh, hey, Elizabeth, thanks. Thanks so much. And don't forget, make sure you put that word free next to your name, and I can get you that free treatment. So, a lot of my clients, they'll say on the phone, maybe I haven't seen them yet, but they'll say, gosh, I feel like Rudolph the Red-Nosed Reindeer because I have so many capillaries on my nose. So, oh, and by the way, I've got my Nessun Pro cup. So they want to get rid of some of those broken capillaries. So I'm here to help them. So let me shrink myself a little bit here, maybe this way, maybe that way. Okay. So let me get to the next slide here. Whoop. So this is the kind of results you can get with one treatment. So if you have some broken capillaries, maybe you know someone who has a lot of broken capillaries or what we call telangiectasia. Ooh, what a word. So it sounds like something very mysterious, but they're actually just broken capillaries. And we can treat this very effectively, just like Susan Kirk, who trained with us on her Skin Classic. And this nice gentleman still had a little reserve left, but he didn't really care. He didn't want a second treatment. He was perfectly fine. But in my office, I would treat this client here, probably in my office, if you'd like a reference point about how much it would be, this nose would be $300. Now, if he came back with that little bit left over, I would go ahead and treat him for $25 as a follow-up fee. Whether I had to do one capillary or two, it didn't matter. That's the price of my follow-up treatment. So you can be assured that you're not going to be charged the same amount every time. Now, this nice man, he probably had a lot of sun damage to his nose. So that's why these capillaries are broken. And he's got that underlying weakness in his skin. So I know that he will develop more of these capillaries as time goes on. So with that said, you'll be able to see him again maybe another year from now. So you should encourage, I encourage my clients like you guys to come in every so often. Let me take a peek, because you don't want to wait till they get this bad again. Maybe when you have one or two, I charge $25 per irregularity, but this was quite a bit. And so I would bundle that treatment, and that would have been a nice treatment for anyone in my office. And yes, oh, hey, great, great, great. Everybody's from Wisconsin. Sound is good. Thanks, Brenda. So let's go on. And I want you to see and know that these broken blood vessels on the skin, sometimes people might say, oh gosh, he must be a drinker or something like that. But you know what? Most of the minor skin imperfections that creep up on us are a lot of them induced by the sun. We get sun damage. Think of all of the ranchers, the farmers. They do have a lot of capillaries, and I treated many of them out in Colorado. And it wasn't from drinking. It was from the wind, the sun. It makes that skin underneath a little weak, and those little vessels will break and pool. So good skin health and SPF will help keep away some broken capillaries. Of course, some people that get a lot of broken capillaries could be allergy sufferers, people that tend to, touch their nose a lot, rub their nose. So we want to really not do that, and keep our skin in good, healthy shape. This is what some of the capillaries could look like. We have them on our chin. This is our device with our little tiny precise probe. And I'll show you exactly how we utilize this. Okay, let me pop this on, and you'll see exactly how we treat this. So little probe, super precise, and it dehydrates this capillary. Unlike what you receive treatment maybe at the dermatologist's office, it could be they may cryo things, freeze them, or they may use a cautery device. This is not cautery. This is a dehydrating type of current. So you're not creating a burn that needs to be healed with ointments. You're going to get a little crust, but the crust will slough off in 5 to 7 days. And we like to keep it dry, just with some nice moisturizing sunblock, something that's gentle on the skin. We don't want to use anything that's oily or A&D or bacitracin, and we stay away from that because this is not a wound. This is dehydrated. So there is a big difference from when you go to the dermatologist and when you come to see me. I don't want to create a burn, and this, you'll never smell flesh burning. If you had anything like maybe cherry angiomas or keratosis in the hairline, it will not burn your hair. You won't smell flesh or hair burning because it's not that type. It's not something that you'll hear. It's silent. It's not zzz, zzz. So it will make you a little bit more at ease than a cautery device. Let's see. Okay, great. And again, if you want free treatment, make sure that you put the word free next to your name, and we'll get a winner later. And also, if you are one of my providers out there and you want a copy of this slideshow, then next to the name, next to your name, I'll have my trusty assistant send you the link, but just let us know that you would like the slides. So just put the word slides in there and we'll get that to you. So maybe you can also encourage your clients to come in for Skin Classic treatments and also see their dermatologist. I think it's a great win-win when we ask our clients to see the derm as well. So you can see that now you can see the results here. And when you come into my office, I always share with you my before and after book. It's super important, not just to see all the great results, but like this slide here, I want you to see how things will look before, right after, and why they heal, so that you will know that everything you get will have a crust on it. And if you're not prepared for that, we can do that at a different time. But I want you to know exactly what you're getting into. Now, it's not something that you will hide out for weeks or can't go to work. You can wear some concealer if you like to do that, so long as when you take it off, you're gentle on your skin. We don't need you to, maybe a long weekend, but those crusts will be there for 5 to 7 to maybe 10 days, depending on how quick your skin heals. Everybody is a little different, but I like for you to know that, so that when you come in for a consultation, no matter what the imperfection is, you will see pictures in my book of before and afters, so you can actually see what the results could be for you. And you'll see a lot of those as well on my page here. So I love to share those with you. And I like to share things that we can't do. You know, a lot of you, when you call me and you say, well, I've got broken capillaries and I've got a lot by my ankle or whatever. I don't do the legs when it comes to capillaries. The legs, you can see that these are deeper. So when we're treating capillaries in my office, I only treat the bright red ones right at the epidermis, right there. And the legs are, for me, a no-no. They take a very long time to heal. And it's something that would be better suited, say, go to a nurse that does scleral therapy where they inject the capillaries, or maybe a laser specialist. So I take care of the bright red ones like you've seen in the previous slides. And like this, these are bright red, and this was a beautiful result by Amber Lockard. She's a fabulous provider, and this took a few treatments. So I generally say like maybe 1 to 2 treatments, but sometimes they can take a little bit. So she did treat this client in different stages, and she was perfectly happy that way. So we can do things all at one time and then maybe a follow-up, or we can break them up too, depending on your tolerance too, because it is a little stingle, but it's not that bad. So we generally don't numb the skin. The treatment is very quick, and the stingle is there just when we're on the skin with the probe, and when we're off, it's generally, you won't need Advil, Tylenol, or anything like that, I promise. And you can see 2 treatments, right? This is a great result by Lillian, and she's an awesome Skin Classic provider. And I just love this picture, but this is what you can expect in my office as well. And Lillian's been using her Skin Classic for years now and is very astute with it. Now, we have other irregularities. Now, sometimes we don't know what the irregularities are that we have. Some of our clients that have sebaceous hyperplasia, if you had sebaceous hyperplasia, you probably know because they've bothered you, and you've sought some help out or you've asked someone, but sometimes too, you don't know what they are. So sebaceous hyperplasia is inverted like an oil gland. And this is Governor Chris Christie, and he's got sebaceous hyperplasia. They don't show up super great on film because they're fleshy colored, but you can see he's got a few down here and up on his cheek. And all they are is sebum that gets trapped in the skin. And there's actually no other treatment that I know that's better than this. This is one of our most sought out procedures for sebaceous hyperplasia. And let me just get to this. So when I do the sebaceous hyperplasia in the office, you will see Fred here has been a model for me in different trainings in New Jersey, in Pennsylvania. He's awesome. And you see the sebaceous hyperplasia on his cheek. But look, this, you can see, you can see that he has a little red mark everywhere we worked. He knew that he was going to have this done. So if you are someone who has sebaceous hyperplasia, please be prepared. You will have a crust everywhere we work. Look, the picture on the left, you can't hardly even see them, but people with sebaceous hyperplasia, and you know who you are, will definitely want this procedure, but you've got to be prepared for the healing process. So the healing process is this red mark there for 5 to 7 to possibly 10 days. But our clients that have sebaceous hyperplasia generally have oily skin, and oily skin heals very quickly. So you can rest assured that they will heal, and you will get an awesome result, just like he has on the right-hand side. Fred is one of my most favorite models, and we haven't seen him for a few years. I'm sure by about now, he's due for another treatment. Not because we couldn't get rid of them, but because he's probably gotten more of these. So a lot of these irregularities, you will find that clients are happy for a very long time, but then, oh, they start, seeing and feeling a few more cropping up. So when they start to see these is when they come in. So just like yourself, I may see you maybe once every 8 months or something like that if you're just coming in for the irregularities. Let me move along here. So we'll say goodbye to Fred right now, and let's see exactly how we treat this. So the probe that we use is very precise.
Every single one. It just over-traumatizes the skin.
You'll be able to see the sebum
tiny little
rise
circles
right up.
all the way around. Now this, you can see the middle of the pore there, and what I'm going to do is start here, go around, 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 circle, circle, and one in the middle. Here's a blackhead. I'm just going to go in perpendicularly. There we go. Good. Another. And I do have my little tool in case they're just a little larger. There we go.
Let's get to it a little bit.
And being able to rid themselves of this. It's been one of those real problems for them, and the estheticians as well. If you go to the dermatologist, I'm sure the derm will mostly say, well, don't worry, that's no problem. But to do all of these sebaceous hyperplasias in a derm's office would be terribly expensive to do, and they may use a hypercator, which is more of a cauterizer. You can see some sebaceous hyperplasia here. Circle, 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 circle. Comes right out through the skin.
So that sebum, let me...
Circle, 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 one in the middle. You barely are touching the skin, but the energy delivers right into the sebaceous hyperplasia and pulls it right out of the skin. You okay, Kenny?
So I wanted you to see that video.
Every single one.
Because you could see how quick the treatment is. It's not something that will take an exorbitant long time to do. There is just that healing. So it's just that easy for us to do that and get you in and get you out. Now, we also see a lot of, I already told you, a lot of things creep up on us, and things like maybe we may refer to them as like barnacles. Sometimes clients won't really know what a seborrheic keratosis is. They think it's something like a disease. So, in other terms and more layman's terms, we could say like a barnacle-like object, or it might be something that maybe it looks like you flung mud at someone's back on the beach. So those are the things like here, this nice gentleman has, let me get rid of that. This nice gentleman has the keratosis on the sides of his face, and he was treated to a treatment in Pennsylvania by Lorelei, and he looks fabulous. So I think let me just do that, and you can see his pictures. Now he's also in our before and after book. So he had a wonderful result, and when the brown like those are out of the face, we look so much younger. Brown dots, spots, whatnots can make us look older. So this is a treatment that will make you look younger, because really these days we all feel better as we get older, not like back in the day. So we want to keep up with how we feel. So we want to keep the brown spots away. And this is how we do it. So the keratosis is something that we definitely love to treat. And like this nice lady had multiple, and this was just 10 days after her treatment. You can see all of those keratosis, and then completely gone, just a little residual left over that could be treated, but she was ecstatic. So you can definitely expect results like this in the office and with any of our providers that you find on the map. We treat things like, and this comes to us from our very talented Jennifer Delk, Boaz in North Carolina. She's also an awesome Skin Classic trainer. But, you might have those, what we call cholesterol deposits. This was one treatment by Jennifer. She is an awesome provider. So there's lots of things like this that we can treat for you. Let's see. Oh, also, a lot of, say, laser studios or physicians, estheticians, nurses, sometimes we shy away from working on darker skin because of the Fitzpatrick scheduling, which may sound a little foreign to you, but we can go from, say, somebody that might be a Fitzpatrick 1, like Nicole Kidman, all the way to a Fitzpatrick 5 that would be like Whoopi Goldberg, right? So we have that spectrum and all in between. So many procedures that are done aesthetically in offices may be off limits to those upper level Fitzpatricks, like 4, 5, and 6. So, but with the Skin Classic, we can treat the darkest of skin without problematic hyperpigmentation or hypopigmentation. And the reason this is because our treatment is epidermal. We're not going in and treating the dermis where the melanocytes. That's what gives us our skin of color. If you're tan, you have more melanocytes. Nicole Kidman doesn't have as many as, say, a dark Italian or a Hawaiian or an African American. So we're not treating those deeper levels where, say, you go to the dermatologist and they want to freeze your brown spots or freeze a few things off. That freeze actually goes deep into the dermis, and it can mess around with those melanocytes. But the derms aren't always too involved in that. Sometimes they don't care, not because they don't care, but maybe they're working with an actinic keratosis or a precancerous lesion where a little hypopigmentation versus having it is worth it. But here in our cosmetic practices, we do everything in our power to keep the skin from hypopigmenting and hyperpigmenting. So with this device, we're only working on the epidermis. So you will get great results even on dark skin, so long as it's cared for properly. So let's take a, so you can see beautiful results with just one or a follow-up treatment. And no hyperpigmentation required. Just really be able to allow. Okay, so you can see fabulous results even if you do have darker skin. I always worry about everyone's skin, but with this procedure, I don't so much worry about the darker skin unless, of course, you've had melasma in the past. And what is melasma? Melasma is sometimes referred to the mask of pregnancy, where you might have some splotchy brown on the forehead, the nose, the mouth. Well, those clients tend to really hyper react to this treatment. So they are a definite no-no for us. Even if they have a few spots on their face, we will just pass on that. And my form that you fill out will allow you to let me know if you've ever had it. If it's something that I just don't recognize right away, maybe you've had it 2 years ago, it's under control, but it's something that I like to know because occasionally, I do have to say no to a skin classic treatment. As much as I hate to, it's something that we have to do. We want to make sure that we are undertaking the correct client for this procedure. And here we go. I want to show you a little bit of this procedure for the DPN. Here we go. Let me just pop up here
There,
a
so
little
she can
bit.
see what it feels like.
And you can see that it might make her tingle a little bit. You might see her eye twitch, and I'm never going to say it's painless,
This is
but
a
it is
sensitive
something that
area.
can get through
You
with
can say it
good
a little bit.
stretching, a calm
Might try to
demeanor,
stretch the skin
and you'll
here.
find that in
Really
my
makes a
office that
little bit of
I
a
try to make
difference.
you as
As we move
comfortable as
down lower,
possible.
you won't find that ouchiness as much. So we're going to try
Ooh,
to be methodical in our fashion
there
here.
we go. So you can see that we're tapping and touching the
Even these
skin.
tiny
We're
little
not
ones, they're not going to get
inserting, we're
any
not cutting, we're not bleeding,
smaller
there's no band-aids. It's not medical procedure. So
because of
this is something that is
floor.
very superficial.
No
But
current, so you won't
she was
feel
in the
that same
slideshow just a bit ago
sensation.
and her picture was beautiful. She was an awesome model for me. And she probably now has a few more of these. This has been about 4 years ago that I saw her. And if she was back in my office, I will guarantee that she has more of these. So that won't surprise me because we just can't stop the aging part. We have to know that they will just get more of these as they move through their lifetime. And one of the things I ask my clients that present with this is how about the family members, your aunts, your uncles, your mom, your dad? Do other family members have these? And invariably, yes, some of them do. It is hereditary. So if you are someone who I've treated in the office and you have a family member that needs the treatment, remember, I'm giving away a free treatment at the end of the broadcast. So if you want free treatment, just put the word free and you'll be in on my giveaway. So let's get moving here. So little sunspots, we can treat little sunspots. We love to clean up the skin. It makes us look younger. And these were beautiful. Melissa, one of our very talented Skin Classic providers, trainers, extraordinaire, um, did these little sunspots. And look what a beautiful job that was in one treatment. We generally like to treat small sunspots. We try to keep it under the size of an eraser head. If you have spots that are larger, we might treat them half now and half in a month. We don't like to do anything too big. And the reason that is because not that our machine can't do it, but quite honestly, it's hard to adhere to our aftercare, which is leaving it alone, because a large spot will take longer to slough, and some clients just tend to pick at them a little bit. So we like to be more safe than sorry and do the spot maybe in two different segments. That would be something that I think is a better fit. And of course, we love to treat skin tags, probably our very number one irregularity that I treat, probably my providers treat, my trainers treat. So if you have skin tags in utterly all the wrong places, then you are in the right place. So I can clean those up for you very well. Um, because you do know that I am a self-professed skin tag queen, and I'm happy to look at your skin tags. We don't treat skin tags that are irritated or maybe that you've already picked at. We want to make sure that anything we treat to dehydrate is in good shape. So we don't treat anything that's irritated or roughened up, and we can always take a look. Of course, you know that I look a lot with my derm light to make sure everything looks normal and healthy. And if it doesn't, I am not afraid to say that you should either see your dermatologist, or I have one in my back pocket that you're able to go see as well. But skin tags can, be anywhere: the neck, under the arms, on the torso, sometimes in the groin area. We can treat all those. Just know that the most treatable, the ones I love to treat, are out in the open. It's out where the air dries them. If we're working under your arm, which is perfectly fine. However, if you say we're a cross country skier, you would maybe want to take off for a little bit, because we don't want that constant friction under the arm or anywhere where we have worked. So most people do have their skin tags on the neck, and they're the ones that are the most unsightly, the most cosmetic ones that we see. So very easily treated on the neck, and they usually take about 5 to 7 days. This was a beautiful result here in Cape Charles, and she was ecstatic because she was very embarrassed by her tags, wanted to go to the beach a lot, but just didn't feel like she could. Well, once she was treated, it really was life-changing. So if you have something like this, by all means, come see me. My consultations are always free, and we can see what we can do for you. Skin tags, like we say, come in all the wrong places. This nice gentleman had his under his eyes. You can see with one treatment what a difference it makes. So, people can be self-conscious about certain things, but there's no reason to be, because you can come see me. Watch how easy this procedure is. Now, you might think, okay, the eyes are so delicate. I can really work, you can work around my eye. Well, of course we can work anywhere, but I want to show you that how precise this is, and how even if you have them on your eyelashes, your eyelids, it's something that we can treat.
So I'm just going to turn your head this way.
And Ray, you're also
I'm just going to moisten it a little bit with a little witch hazel.
drink myself here.
And you can just let your eye relax. Okay, so I'm going to give you a couple touches so you see what it feels like. Scale of 1 to 10, 10 being the worst.
A little higher, like maybe a 3 that time, but still nothing major.
Okay, great.
See, easy peasy.
That's the witch hazel that you hear snapping a bit.
So you can see it's a quick procedure. Each
Awesome.
side took under a couple minutes, and he was very
The
tolerant,
duct tape helps.
and he's even smiling. So the other side went just as well as the first side. So you can see that it is very easily treated, even if they are under the eye. So you can imagine we can treat anywhere else very easily. So you can look forward to a treatment like that. But you saw that was really under a minute that it took to treat. So besides the things on the face that we treat, we also treat hands. And probably one of my favorite procedures because, a lot of our skin classic clients or our clients in the office, if you do microdermabrasion, peels, all of those good procedures, sometimes we neglect doing the hands. And when we look down at our clients' hands, which I do all the time, I like to have their hands look as great as their face. And there's one way to do it, the Skin Classic. And remember back in the day, Madge was always having people soak their hands, getting them ready, getting them beautiful. Well, I like to do that too. And I do it with the Skin Classic. You will see treatments for sunspots. And let's go on to see this one here. Okay, so we did a hand treatment not too long ago here in the office during a training. So this was actually one of the nurses doing a training in my office. And you can see that we very lightly tap and touch the skin. We're looking for all of the brown spots. We identify them, moisten them, and then you'll see how lightly we touch and tap. But don't be fooled by the lightness of the touch and not really seeing a result like our skin had just before.
Yes, ma'am.
This will all get a crust on it. And when the hands get crusty, they get really dark. So your clients need to be prepared, and you will see some photos, of course, in our before and after book. You're going to see great pictures of hands and the spots, how they heal.
What is this called?
Finding one
It's
here.
called thermolysis, so it's an electrical current. And it dehydrates most of our irregularities, but these were adding a little moisture
You
to
can
them
see
to
that
help lift.
get pretty dark in
So
between.
it's not
So you've got to
cauterizing,
be
that's why you don't
prepared for
smell
that.
any flesh.
But very easy to take care of. You're just going to wash gentle, right? And pat dry and put on your moisturizing. I love to use the Definage in the office. I suggest my clients use it. It's a very good healing type of moisturizer. And but anything gentle is good. And of course, you've got to use the sunblock after. And you'll want to use sunblock on your hands forever because that's the reason we're getting all these brown spots.
You're good. Relax.
So let me just
Is that okay?
this one.
It's fine with me. All right.
And our clients are fine. We have so much fun with our clients in the office. So, Melissa, I don't know if you were just on a little bit, but I had your picture up there too with one of your great photos of the sunspots. So I'm not sure if you saw that. But let's move on here and So these are some more results from our talented providers, before and after photos of the hands. Isn't that just wonderful? Wouldn't you love to be able to look down at your hands, whether maybe you're an accountant, maybe you're a banker, maybe you're somebody that works with their hands, maybe you call bingo or something, and you can proudly wear your hands now after you've had a Skin Classic treatment. And Beatrice, one of our trainers down in the Atlanta area, she is awesome. Look at this fabulous result. And this was one treatment. Now, just remember, those brown spots are going to get way browner, but they don't get bigger. It's not like going to the dermatologist and then freezing it. And you know how the freeze kind of goes outside of the brown spot and it might make it look bigger like a bullseye. So this is so much more precise and but fabulous result there. So I'm going to see if there are any questions. Oh, you're in Clearwater. Awesome, awesome, awesome. Okay. So I am going to spin, spin, spin. But before I do, I just wanted to also make sure that you know you can message me. I'm very responsive. So if you have a question, maybe you had a few questions, but maybe you just were a little shy and you didn't want to pop them out here where people would see you, just let me know. Message me either right here on my Facebook page. You know that I am streaming right now on LinkedIn, on YouTube, in my group, Thermolysis Skincare for Estheticians. So you can just circle back and message me any of your questions. And let me just see here. Okay, good. So I'm going to spin, spin, spin. And here we go. Marie Buffkin. Cool beans, Marie. So, Marie, you're our winner of the Skin Classic procedure. Go ahead and private message me. We'll get you all hooked up, get you your information that we need to send out to you. And prior to your procedure, maybe you can take a couple selfies and let me know what it is that you would like treated. So, I'll just recap for you guys. If you are in my Cape Charles viewing area, I am on the eastern shore of Virginia, right down at the tip of the Delmarva Peninsula. Then make sure you hit me up. If you feel like you have any of the minor skin imperfections that we kind of went over today, I can show you how we can easily treat these. And this is available in replay. So if you didn't get a chance to see it because of the day, it is a holiday, then come on back and watch it later, or just watch it on my RN Faces page. It will be available in replay. So I hope to see you all again in the future. I will see some of you next Monday as well. So until then, let's go out there and slay those skin tags, annihilate those barnacles, and just take care of all of those spots, dots, and whatnots. So I'll see everybody later. Thanks for tuning in. And Marie, congrats. Awesome. I'll talk to you all another time. Bye-bye. Oh, let me give you one last slide here in case you don't know how you can find me. I am on Facebook, Instagram, TikTok, LinkedIn. My links are here, and you'll be able to find me in any of those spots. So I will see you all later. Thanks for tuning in. Bye-bye.